Hi, I'm Clint Kuntz. I'm the CEO of Fairfield Community Health Center. I'm also the policy chair for the Ohio Association of Community Health Centers. Fairfield Community Health Center is located in Lancaster, Ohio, and we are the only federally qualified health center in the entire county. Fairfield Community Health Center was funded as a health center in March of 2009, so we've been open approximately 2 years. This past year, as of 2010, we saw approximately 3,500 patients and 10,000 visits for those patients. This year, for 2011, we are projecting to have 5 sites operational to serve approximately 10,000 patients and over 25,000 visits. Under this appropriations cut, our health center would shut down, and all these patients will lose access to care, and they have nowhere else to go for care other than the ER. This cuts will also affect other health centers across Ohio. Many of these health centers are the only source of care for their entire area or entire county in many cases. Without the health center funding, we would not be able to keep our doors open, employ our staff. We currently employ 29 employees and a payroll of over $2 million a year, which would go away. With this huge cut to the funding, $1.3 billion of a total budget of $2.1 billion, which is over 60% of the budget, many health centers will have to shut their doors. It's not just the cut of the funding, it's the way health centers, they will also lose access to tort protection and many of the other things that go along with being a health center. And with these cuts, health centers will not be able to afford to keep their doors open to provide care, not just to the uninsured, but to many people who are insured and have no other access to care. The reality of these proposed cuts are that my health center will shut down, my 29 employees will be without jobs, and my 3,500 patients we're currently treating and the 5,000 patients we are adding this year will be without access to care. On behalf of our patients, I'm asking Fairfield Community Health Center's Representative Steve Austria, U.S. House Speaker John Boehner, and the entire House of Representatives to help keep health centers like mine open by level funding our health center programs at 2010 levels of $2.19 billion for the remainder of fiscal year 2011, and help ensure adequate funding for the future of health centers.